I am the director of our Create Better Health program. It's our SNAP-Ed program in Utah. And I have been lucky to be part of both regions that will be represented today. The Mountain Plains region, we were part of that a couple of years ago, and we're able to participate in the regional reports. And then now I am part of the Southwest region. So we're pretty excited to share this report and some findings from it. And then also I wanted to just mention that we have Amalia Larson, who is also part of our Utah team, and she is helping us to facilitate. And sorry about the technical difficulties that we've had. We had some issues with the computer and had to put it on another computer, download presentation, but we're ready to go. And just next slide, please. Some housekeeping. If you would like to see the subtitles, I actually don't see them today. So if they come up, they will be on the bottom part of your screen, and you're able to click on the live transcript and it will give you a CC spot. And I'm sure because we changed computers that we're having just an issue with that, but I'll check on that in a second. And then also, as you noticed, the session is being recorded. Please keep your line muted. And this is particularly to our presenters because everyone else will be muted. And then when you're up to present, you can unmute yourself. Everyone, please put your questions and comments in the chat, and I will facilitate the questions and ask them at the end of the presentation. And now we will turn the time over to Philip Fraley and Gregory Jones. They are our leadership from the Mountain Plains region and the Southwest region. Next slide.
Thank you, Heidi. Good morning, everybody. Thank you for joining this webinar. I won't take up too much time because we have a lot to cover today. I just wanted to thank all of the people who have made this year's bi-regional SNAP-Ed impact report such a success. This year's report is significant because, as you'll hear, it highlights the amazing work that state and implementing agencies did to overcome the pandemic and still administer SNAP-Ed to those most in need. These organizations did not sit back during the shutdowns and social distancing that was necessary in 2020, but pivoted their efforts to continue to serve those eligible participants. This report not only highlights those incredible efforts, but showcases how it directly impacted people's lives. I just want to thank everybody being part of this, and then I'll turn it over to Gregory in the Southwest office.
Good morning, everyone. This is Gregory Jones from the Southwest Regional Office. Here we are once again with more good news about nutrition education outcomes for the Mountain Plains and Southwest regions. Even during a very challenging time for all of our state agencies and implementing agencies, we didn't stop ensuring access to nutrition education. We would like to take a moment to thank all of our SNAP-Ed professionals, their staff, and the support of all of our program coordinators. Sharing positive program outcomes for SNAP-Ed, even during a pandemic, is tremendous hard work. And we wanted to highlight the adaptive efforts of our regions, regardless of the obstacles placed in the way. This will show others we are ready and able to meet the challenge. We want to thank you all for your work, for continuing to do the work that you're doing. This report will share how nutrition educators in both our regions provided opportunities to create change in a multi-sector levels. State agencies and implementing agencies have shared their progress in meeting the needs of our participants through diverse educational approaches, that is youth direct education, adult direct education, social marketing, PSEs, which are policy systems and environmental changes, and indirect contact and social media. We all, once again, have done a fantastic job. So thank you all. Next slide. And again, we're having these technical difficulties only on the day we are ready to present this webinar. But we will begin by sharing our report structure with Kaylee McCracken Goodenough. And after Kaylee, we'll have Max Young from Mountain Plains, who will share our fiscal year 2020 cross-regional outcomes, even during COVID. Followed by our state highlights. We will hear from Colorado, Cooking Matters, Christina Miller, and Oklahoma's ONI project, Meredith Scott, and ending with any questions or comments you may have. Next slide. Our objectives for this webinar are as follows. We will describe ways SNAP-Ed expanded. Oh, next slide. I'm sorry. And these are some of our speakers. Let me cover this slide. These are some of our speakers. Well, Heidi LeBlanc is our moderator. Philip Fraley is from the Mountain Plains region. Myself from the Southwest. We have Kaylee McCracken, good enough from Wyoming, SNAP-Ed. Max Young from Mountain Plains. Christina Miller, Meredith Scott, and then we also have Lori Kelly, who's going to do the summary. Next slide. Our objectives, again, are to describe ways SNAP-Ed expanded the use of technology, enhanced partnerships, and delivered programming to meet community needs. We want to also share that we learned how the nutrition education programs pivoted programming to include online virtual programming and how this enhanced opportunities to reach families, and understand how a multi-tiered social marketing strategy aimed at farmers market provided fresh fruits and vegetables for families during COVID. Without further ado, Kaylee, would you kindly share with us the background and structure of our report? And again, thank you all. Next slide.
Thank you, Gregory. My name is Kaylee McCracken Goodenough, and I'm the Marketing Coordinator, Program Coordinator Senior for Wyoming SNAP-Ed, which is called the Sensible Nutrition Program. And I was the designer behind the report this year and last year. So I'm going to just share a little bit of the background and kind of how the report came together. Next slide, please. So the report is a collaborative effort. Obviously, all of the states, all of our implementing agencies, state agencies had to come together to make this happen. It was developed between Wyoming, Utah, and Colorado to pull all the pieces together from the various agencies and states into one concise report. And we have it organized into a couple of sections to help kind of keep the flow of it and make it approachable for a variety of audiences. So overall, when we were working on this, our first step was collecting the data from everyone, and I'll talk about that in a moment, to design it in a way that it was going to be simple and understandable across regions, across states, and across the country, and then share it in a meaningful layout so that the stories we were telling have impact. Next slide, please. So this is just a kind of a look inside. We do have a table of contents to help people navigate through it. The beginning part of the report is focused on kind of the bare bones of what is SNAP-Ed and how do we do it. And then we have it divided out into the two regions. And we're going to talk about that in just a moment. I will say last year, as we were switching between states, some states moving to different regions, we had a few more states than we had this year, but I think this year's report really came together strong, especially as both of our regions were familiar with the process and knew what kind of data to use to tell our stories. Next slide, please. So each regional section of the report begins with kind of a snapshot of the SNAP-Ed challenge. We look at some common health indicators for each state that SNAP-Ed works on improving, and looking at things like obesity and chronic disease rates. Then next slide, please. From there, we do talk about solutions, and then we have the individual reports for each state. And so the report is definitely not a research report, and it's not a comprehensive annual report. It is meant to be a highlight report and to show our successes. We designed it to show the incredible impact that SNAP-Ed has. And this year, of course, we face a lot of adversity in our programming and in our work because of COVID. And so this year, we also wanted to highlight the efforts that went into making programming happen and relevant during a pandemic. We wanted to show the ways that SNAP-Ed rises to the occasion to meet needs in every place it serves, regardless of the pandemic or the situation happening around us. We focus on things like commonalities. So as we were looking through the data across all of these states, what stories and data are common throughout regions, throughout states, and throughout agencies. We tried to stay flexible, understanding that each program operates a little differently, and especially in 2020, even our norms changed pretty drastically. Keeping the report simple is also one of the things we really focused on, because we did want it to be approachable for anyone who wanted to learn about SNAP-Ed and the things that we can accomplish. And then the last kind of approach for me is to make it approachable, so that whether it was a state representative who was reading it, another SNAP-Ed program, a state agency, or even just a lay person, that they could pick up the report and look through it and walk away with some understanding of what was accomplished by SNAP-Ed. Next slide, please. As I mentioned at the beginning, we start with data collection. On the screen here, you see 2 templates, which we developed in 2019 and tweaked a little bit for 2020. One is a checklist that lets states know what it is that we need from them. And then the Excel document is the place to put the data and the numbers in that we then turn into graphics. Next slide, please. But as we all know, 2020 was not a normal year, which Max is going to talk a little bit about COVID-19 and how we persevered through that. But one thing that we did want to do is have a page in the reports for each state that talked specifically about their experience with COVID and how they kind of rose above it. And so what we did is we needed some sort of common format for collecting these stories and this data. And we actually used the ASNA template that was shared last fall as kind of a common ground for collecting those stories. So through this, some states did opt to use their own templates, which was fine, and that required a little bit more discussion and negotiation as we were working through the data. But overall, using these common templates allows us to speak a common language as we're looking through data and programs and find a way to present it in a way that's uniform across the report. Next slide, please. And so the last thing we kind of wanted to end with, at least for this background section, is that this was our second year of doing a multi-region report. And I think we've learned a lot along the way. One of the key things we've learned is that it's really important to have 1 to 2 regional contact people available to help with things like scheduling meetings, setting up the folders for data collection, reviewing and following up. We all have so much going on, and having a point person for each region makes that a smoother process. Similarly, having the correct contacts for each state, whether that's the state agency or implementing agencies, to double check data and layout has been essential. For those states with multiple implementing agencies, I think we've learned in the last 2 years some new strategies for aggregating data across programs in one state, so that the state report represents the whole state, despite how many implementing agencies they may have. And at the end of it, it's a huge process. This year took us 4 to 5 months to put everything together, because there was a lot to sort through, and COVID did add a challenge to that as we were dealing with new data. But at the end, we have this report that captures all the positive impacts that SNAP-Ed has on our participants, our communities, and our states. And Max is going to take it over from here and share some of those outcomes.
Great, thank you, Kaylee. Next slide. Perfect. Hi, everyone. It's so good to be here with you. And I'm sorry you can't see me as I present, but I am here. I am a new FNS coordinator working in the Mountain Plains region. And today I'm very excited to give you some high-level outcomes from 2020 that were in the report. And so SNAP-Ed, as you've heard, we didn't sit around. We changed and pivoted our programming, going from primarily in-person nutrition education to virtual lessons, and also nutrition ed that was tied to the emergency food distribution response. And for those that are familiar with SNAP-Ed, you know we work at an individual level, helping to change and influence the individual's habits. But we also help to influence the environments where people live, with the goal that they can actually practice the healthy habits they learn in our classes. These are known as our PSE approaches, our policy system and environmental change approaches, but social marketing also fits into there. And I think what you'll see as we go through the next several slides is it was those comprehensive approaches, the individual education, the PSEs, and the social marketing that came together to allow SNAP-Ed the opportunity to meet people where they were in the way that was best for them. And so what I'm going to do is step you through each of these high-level outcomes that we saw when we looked back and reflected on the year, and provide you some state examples so you can see really what we're talking about and how we came to those. So for the next slide. The first outcome we'll talk about is enhancements to our referral system and our referral processes. As job loss became more severe and hunger more prevalent, it became critical to connect the SNAP participant with SNAP Ed classes. But it also became critical to connect the SNAP participant to other nutrition and health related services that they might be eligible for or newly eligible for but had not participated in the past. By doing so, by enhancing our referral processes, we hope to ensure that we're providing equitable access across our program to the community, while also helping to strengthen the nutrition security safety net that our country has worked so hard to build. Next slide. For the first example we're going to look at, it's Wyoming. And in Wyoming, they actually established a system level change to their referral system. This allowed the SNAP applicant to actually identify on the SNAP application if they are interested in SNAP Ed classes. And once that participant had given the consent that they were interested, their names were then provided to Sensible Nutrition, which is the implementing agency, for additional follow-up to get them into classes. And in 2020, they received almost 1,000 referrals from SNAP applications alone. But what was unique was alongside of this referral process changed, Wyoming also released an internal social marketing campaign to explain how SNAP and SNAP Ed go hand in hand. The goal of the campaign was not only to increase the success of the referral system, but also to help train the eligibility worker really on the availability of SNAP Ed classes and what SNAP Ed does and doesn't do. And based on the evaluation of the campaign that Wyoming has done, we believe that it has been successful. Eligibility workers are reporting an increased familiarity with SNAP Ed and also an increase in the frequency of their referrals. So on the next slide, we're going to talk through Texas. And in Texas, the state agency contracts with 13 different implementing agencies. So given the scope of SNAP Ed programming, you can imagine how many processes really needed to adapt due to the rapidly changing climate of COVID. But for the example in Texas, we're going to focus on one of their implementing agencies, which is the Texas Department of State Health Services. And for this IA, they had to really rethink their promotion strategies as a result of COVID. So the focus really shifted on using social media, radio messages, and billboards. And within 3 months, 6 local health departments had integrated social marketing into their projects, which included 615 social media posts, 3 billboards, and 2 radio broadcasts. The promotions were really focused on the impact that obesity and chronic disease can have on COVID-19 risk. And through these avenues, they distributed nutrition education tips, healthy recipes. But what they also did was serve as a connecting point for the community. They connected the community to other health resources that the individual might have be eligible for or might be available to them within their networks. On the next slide, we're actually going to change topics, but it's along the same lines of referrals. We're going to talk about pandemic EBT, or PEBT for short. So during COVID, many of you on the call know that we released a new federal hunger relief program that was called PEBT. And PEBT was a food benefit that was provided to families to help make up for meals that were missed by school-aged children as a result of school closures during the pandemic. And uplifting a brand new program was an absolutely monumental task by our state agencies. Its success not only demonstrates the commitment of our state agencies to ensure that hunger is addressed in our communities, but it also demonstrates the strength in cross-collaboration, which we'll talk about here shortly. In order to uplift PEBT, social services agencies had to partner with departments of education and departments of public health as well. And while SNAP Ed wasn't involved in the release or the design of PEBT benefits, it is important to highlight the role that we did play in promoting the benefits and, again, linking the eligible community members to the program. And on the next slide, we're going to focus on the Colorado Department of Human Services, which is the state agency that oversees SNAP-Ed and also helped to elevate the new PEBT benefits. As part of the state agency's marketing efforts, PEBT marketing materials were actually tested by the SNAP-Ed communities, so the SNAP-Ed implementing agencies, both by the educators who teach the classes, but also by the community members who participate in them. And this was really designed to help ensure that the materials that were collected resonated with people, that the materials would allow them to take an action that we were looking for PEBT. Once those materials were finalized and the feedback was collected and redesigned, the implementing agencies in Colorado then played a role in the promotion of the benefit. The social marketing campaign, Eat Better Together, which is designed and implemented by Rescue Agency Public Benefit, promoted PEBT through Facebook, Pinterest, Instagram, and the campaign throughout a large window had 8.6 million impressions and 603,000 exploratory engagements for the entire campaign. But the Colorado School of Public Health also, through their Text to Live Healthy program, which has around 3,000 subscribers, also sent several rounds of text messages through their program to promote PEBT benefits. And here in a little bit, we're going to hear from Christina Miller in Cooking Matters Colorado, but Cooking Matters also found opportunities with the many classes, virtual classes that they were holding to promote the program directly to the people who are participating and also through their social media platforms as well. On the next slide, we're going to delve into the next topic and the next high-level outcome, which is collaborations between programs. We know that collaboration brings us together. It helps us to utilize the resources that we have in solving issues. And in this case, the issue is hunger and nutrition security. And so each of our federal nutrition programs really provides a unique resource that's focused on communities and people across the lifespan. Working together amongst our programs helps us to ensure that we have positive outcomes for nutrition security, greater than any of us could do as a single program. It was a key part of our work during COVID. We leaned on each other. We needed each other to ensure we were addressing the large need that we were seeing. And so for some of those partnerships, they were new, and some of them were things that we had already established through groups like our State Nutrition Action Councils or SNACs, but all with the goal of helping to maximize our nutrition efforts and improve the coordination and collaboration. On the next slide, the state that we're going to highlight first is in the Southwest region. It's Arizona. And in Arizona, the State Nutrition Action Council, or the SNAC, had strategically aligned their state nutrition and physical activity efforts across programs. And this became very important and timely when the state saw an opportunity to support free meals for children during the pandemic. So it was through the SNAC and through that partnership that they helped to develop consistent strategies and timelines for marketing meal programs. They also worked to figure out the best strategies to support the sponsors when communicating the state and federal waivers and the operational changes, which were many during that time. All of this to ensure the partner sites and the families had the most updated information on meal availability. Along with all of these strategies, their implementing agency health zones also mapped meal availability on an online platform and provided bilingual digital marketing tools that were in English and Spanish. And for the next slide, we're going to move over to the Mountain Plains region and talk about Nebraska. And Nebraska implemented a project called Go Knapsack. And Go Knapsack is centered on improving nutrition, physical activity, and infant feeding best practices in early care and education settings. And during the pandemic, many of Go Knapsack's typical partners were under immense pressure. The providers at these childcare sites and family childcare homes are considered frontline workers, and they experienced immense stress as they tried to remain open, but keep their children that they cared for safe and healthy. So in order to understand how Go Knapsack could support the sites, they started by asking the child care providers some really simple questions about their needs. And when they did that, they found out 85% wanted virtual lessons still on the topics that Go Knapsack offered, and 93% already had the equipment available to them to participate in the virtual trainings. So as a result of this continued interest, Go Knapsack was completely redesigned for virtual delivery. And as a result of the hard work that happened in Nebraska, 110 child care providers were trained, 11 home child care settings, and 31 child care centers received the programming. And even though the pandemic changed so many of our practices, Go Knapsack was able to still reach 3,000 youth, with those sites adopting 107 PSE changes. And this was truly all due to the strong foundational partnerships with Go Knapsack, with SNAP-Ed, with child care providers, and the long-standing partnership with Children's Hospital. On the next slide, we're going to talk about South Dakota. In South Dakota in 2020, the implementing agency, South Dakota State University Extension, received a CDC 1809 grant, which they were able to leverage with SNAP-Ed to help expand the services and reach of the program. Ultimately, the purpose of these funds and the leveraging of the funds was to help address the challenges of obesity among residents of tribal communities. The activities that were identified through this grant were focused in two particular areas. One, increasing the access to places that provide healthy foods, and two, increasing the access to safe and accessible places for physical activity. It was through this funding and the leveraging of the funding that SDSU identified partners in two different wellness coalitions. And the partners on these coalitions ranged from the Department of Health, Social Services, Agriculture, Education, Great Plain tribal leaders, and many more partners across the state, including many Native nonprofits. This work is continuing to this day, and we look forward to hearing more outcomes as they develop around those desired changes for increasing access to healthier food and physical activity. On the next slide, we're going to change our topic and talk a little bit about the connection with local farmers and local foods. As we know, farmers markets and purchasing local can be a great source of fresh fruits and vegetables and other healthy foods. And if that market accepts SNAP EBT, then SNAP recipients can shop with their EBT card. And that provides them, that individual shopper, a level of nutrition security, but it also provides a direct economic support to farmers and producers directly. SNAP-Ed has been providing services to farmers markets in a few different ways. And much of this work, what we saw, was actually enhanced during the pandemic, which we're going to step through onto the next slide. So starting with the Southwest region, Oklahoma is doing some absolutely phenomenal work around farmers markets. And here in a little bit, as you know, we're going to hear from Meredith Scott on her work around nutrition education and SNAP Accepting Farmers Markets campaign. So I'm going to let Meredith, who truly is the expert in this project, speak more to the outcomes. But just as a couple highlights, they saw increased farmers market participation. They offered virtual tours and cooking classes and monthly produce highlights as well. So on to the next slide, we're going to highlight Utah. And in Utah, the Create Better Health, which is the implementing agency through Utah State University Extension, has partnered with the Utah Farm Bureau to develop Farmers Feeding Utah. And it was through this partnership that Farmers Feeding Utah was actually able to purchase products directly from farmers and donate them to food insecure families and food pantries. Through this partnership and work, over 550,000 pounds of farm fresh foods were distributed to over 9,000 families and 24 food pantries across the state. And this is absolutely impressive, given that Utah experienced over a 300% increase in their food insecurity as a result of the pandemic. On to the next slide, we're going to highlight Kansas. And in Kansas, the implementing agency, the Kansas State University, has partnered with 3 different organizations to help establish a brand new food pantry. And establishing this new food pantry was critical because not only was the need for food growing, but the county food bank hours and locations became a barrier for some of the community members. The pantry was up and running by mid-June and at full capacity by mid-July of 2020. And the SNAP-Ed educator not only played a critical role in establishing that new pantry, but she also worked to coordinate with the local farmers market to receive food donations that were not being sold. These items were then donated to the food pantry to help increase nutrition security for the clients and the shoppers of the pantry. The educator then even went as far as to ensure the pantry had nutrition education handouts. She provided recipes, nutrition tips, and food safety information, which is so critical during the pandemic as well. For the next slide, we're going to look at Missouri. And during the pandemic, many of the producers and local food systems experienced some disruption in their services. Markets and selling opportunities closed due to the prevention, trying to prevent the spread of COVID-19. And many of the consumers and the shoppers were very concerned about food availability as some of their usual food options became more limited. As a result of all of this implementing agency for SNAP-Ed, University of Missouri Extension, created the Show Me Food website, which easily connected the consumer with producers growing and selling locally procured food and other local food resources that might be available to address food insecurity. As a result of the Show Me Food website, 279 farmers, growers, and local producers in 86 counties registered their location on the website, with over 15,000 unique users visit. And on the next slide, and for the last slide, we're going to talk about innovations in education. And throughout this presentation, you've heard a lot about what we did, what SNAP-Ed did to innovate and design programming that worked for the community. But I'm going to highlight some additional examples that showcases the innovation and responsiveness of SNAP-Ed during the pandemic. SNAP-Ed continues to be an important tool in our country's toolkit of resources that helps to provide support in building healthier communities. SNAP-Ed works to provide nutrition security through education and evidence-based interventions that give the communities we serve the knowledge and skills to stretch their food budgets wisely and well. And during the pandemic, these needs, the need for resources, was incredibly important as hunger became more severe in our communities. The states that I'm going to highlight in this next session showcase the responsiveness of SNAP-Ed, but I also hope that you saw that throughout the different states that I highlighted. So on the next slide, we'll talk about New Mexico. So similar to many of our SNAP-Ed agencies, New Mexico did not sit around and wait for things to open. SNAP-Ed programming was quickly developed to online classes that utilized Facebook, Zoom, and other virtual platforms. Fresh fruit and vegetable samples, along with printed tasting lessons, were provided during school lunch pickups. This helped connect the meals that are being served in schools to nutrition education, even though the setting and the delivery of those school meals changed. It was through their hard work and community interventions that New Mexico was able to reach almost 900,000 participants in 2020. The next state we're going to focus on the next slide is Arkansas. And Arkansas developed a project called Snap to It. This was a virtual learning project that was developed and pilot tested in 8 counties. It consisted of 8 online lessons focused on nutrition, cooking, and physical activity topics. Each of the lessons had a short video with key healthy living information, a recipe, and physical activity demonstrations. And through their hard work, they reached almost 57,000 people with an engagement over 5,500. Louisiana, on the next slide, partnered with the Food Distribution Program to provide nutrition ed toolkits for participants at commodity food sites, which was critical in supporting the emergency food response. Through this partnership and through Louisiana SNAP-Ed's hard work, they provided over 1,300 nutrition and health-related resources to participants directly. Having nutrition education supported during our emergency food response showcases how innovation works. It showcases how we leverage our partnerships between our other federal nutrition programs. And on the next slide, we're going to focus on North Dakota, which conducted an innovative PSE project by partnering with the Spirit Lake Nation on community gardens. SNAP-Ed, the Spirit Lake Nation, and the Chendenska-Chikna Community College partnered to establish a new garden in 2020 with the help of a grant from the Junior Master Gardener program. So in addition to teaching youth about growing, harvesting, and eating vegetables, SNAP-Ed also worked with volunteers to help create and distribute fresh boxes of veggies to the community that was in need. All of this success was supported by partnerships between SNAP-Ed, the Family Nutrition Program, which is the North Dakota State University Extension, Land Grant Extension, the Community College, and Head Starts, all utilizing funds from the numerous supporters that you can see on the slide. And for the last state on the next slide that we're going to focus on is Montana, and Montana's promotion of the Double SNAP Dollars and Coupons project. So as you know, Double SNAP Dollars allows farmers market shoppers to stretch their SNAP dollars. It helps to increase their fruit and vegetable consumption, but also support local agriculture. And in Montana, SNAP-Ed has partnered to provide an additional coupon to individuals who attend their nutrition education classes. This allows the participant to not only receive the double SNAP dollars, but also additional funds for attending nutrition ed classes. All of this work helps to promote farmers markets in the area, encourage the Gus Schumacher Incentive Grant. It helps to recruit for SNAP-Ed classes. And at the end of the day, it does what we're all trying to do, which is help the participant have more access to healthy fruits and vegetables in particular. As you can see in the fiscal year 2020, which is the third year of this project, over 1,700 SNAP participants used the double SNAP dollars. 14 markets accepted the additional coupons, with over 104 coupons provided in 2020. This work continues into 2021. It continues to thrive with an increasing number of participating markets. And so that's going to wrap up this section talking about the high level outcomes for 2020. And I'm actually, in the next slide, going to turn it over to the speakers who are going to talk about their program and how they adapted. Christina Miller will introduce herself, and Meredith Scott will do the same. So without further ado, Christina, I'll turn the mic over to you.
Great, thank you so much, Max, and thank you for the invitation to present today on the work that Cooking Matters has done during the pandemic. Next slide, please. So Cooking Matters Colorado is part of a national organization, Share Our Strength, with a mission to end childhood hunger and poverty, both nationally and abroad. Cooking Matters program has 2 offices in Colorado and Massachusetts, and then a network of over 150 partners across the United States. Throughout the pandemic, Cooking Matters Colorado, Massachusetts, and national partners have increased collaboration so that we are able to build efficiency and effectiveness into our program and share resources across the country. Next slide, please. The goal of Cooking Matters is that all parents and caregivers have the skills to regularly serve nutritious foods to kids pregnancy through the age of 5. And this is our priority audience, but it's not the only audience that we work with and provide food skills education for. If you'll go to the next slide, please. Throughout the pandemic, we really focused on 3 key areas: providing food skills education messages, social media and engagement, and delivering online education. So the next portion of the presentation will focus on these 3 areas. If you'll go to the next slide, please. So first, I want to talk a little bit about our food skills education messages. And as you'll see here, they were delivered in 3 different forms to reach people where they were at and what their needs were throughout the pandemic. All of the messages that were provided were from our evidence-based curriculum, but modified to meet the delivery channel that they were being provided through. We know that people were struggling with the availability of food, with the time that they had available for food preparation, and new challenges that they were facing. So these messages were designed to support the needs that people had during this time. So the first image that you'll see here is a social media image. And so these messages were provided through Cooking Matters social media, but also through partner social media. And in Cooking Matters Colorado, we put together toolkits that were available to our partners that created a thread of messages that included the social media, a shortened message, which is the next message you see here, that could be provided through text, and then a more robust piece of collateral that could be delivered through either a blog post or a website, or actually printed and distributed as part of a food distribution program or other community-based activities that were providing resources out in the community. So these toolkits and these threads that were created were in support of needs that individuals and families were having during this time. And they were important in connecting people with resources available. So on the collateral, you'll see that there's links to more information, and then also QR codes that people could scan so they could learn more about direct education lessons, they could learn more about recipes that were available to them, or find other topics that were important to them during this time. It was really important for us to work with partners in the distribution of these messages. So toolkits were created in support of pantries and distributing food through pantry partners, through farmers market. And then also in the San Luis Valley in Colorado, we work specifically with some of the WIC produce boxes that went home to families over a 13-week period and connected people with education specific to the items that they were finding in their produce boxes. So if you'll go to the next slide, please. Another partner that we had in this work was some of the county human service offices. So really bringing together SNAP Ed and SNAP Outreach for support during this time. And this is a partnership that has continued on even as we are in a different phase of the pandemic now. So wanting to make sure that each piece that was created was supportive of families having access to low-cost recipes as frameworks, with understanding that early on in the pandemic, there was a scarcity of food and sometimes of specific items as we were shopping at grocery stores or receiving boxes from food pantries. And so it was important to think about how we might bring recipes to families in a way that made them adaptable to not only the foods that were available, but also their family preferences and cultural needs as well. On each piece, in addition to the recipe, there's a food skills education message and the connection to additional resources. So here you can see that the not only does it take you to more Cooking Matters information, but it also is information on how to connect directly with the SNAP resources that were available as well in SNAP application. So wanting to cross promote between SNAP Ed and SNAP Outreach for the purposes of surrounding families with the foods that they need during this challenging time. You'll see on here that these are bit.ly links. This is a newer part of our work, and really using bit.ly links so that we will be able to better track analytics and how people are connecting with resources and then accessing additional resources and what they're interested in continuing to learn more about. If you'll go to the next slide, please. Social media was the second piece the second avenue that we pursued in being able to provide education to people during this challenging time. As previously mentioned, you saw there was a social media image that was made available to partners and also through Cooking Matters in promoting messages that were supportive of families during this time. But we also conducted some Facebook Live sessions. So prior to the pandemic, Cooking Matters nationally had done a digital evaluation that really pointed to social media, to Facebook as being the most prominent social media platform that families were using to access content. So when the pandemic started, we knew that it would be important to build on that learning and offer education and offer informational content through Facebook. So we provided weekly Facebook Live sessions in both English and Spanish. And we really started with topics that were relevant to the time where we were hearing that people were struggling with food storage and wanting to maximize their trips to the grocery store so that they went a limited number of times, how to prepare flexible recipes with the foods that they had available. But as time went on and we were more engaged in our social media work and Facebook Live sessions, we heard themes coming from participants that informed future topics and helped to point us down a path that was really supportive of the families who were participating. Most recently, we've been inviting experts to join and lead these Facebook Live sessions. So experts from our partners, our chefs and culinary volunteers, but then most importantly from our participants as well. So we've had participants come and share their lived experience and share their expertise through Facebook Live. And through non-SNAP Ed funds, we've been able to compensate the participants for coming and sharing their expertise with us. So through these sessions, we've averaged about 30 live viewers, but then being able to post the recorded live sessions and boosting those posts, we've gained over 5.8 million impressions with the Facebook engagement. We are currently conducting a follow-up digital evaluation to see if Facebook is still the primary platform that our participants are using, or if we need to expand our reach through other social media platforms. If you'll go to the next slide, please. Great. So wanting to talk about our online delivery of education, because this is really the heart and soul of what Cooking Matters does. So prior to the pandemic, we did participant listening to understand the topics and the delivery methods that were most relevant to our priority audience. And so really from that listening, heard a need to focus on saving time, saving money, and feeding kids. So these flexible lessons were developed for in-person delivery, and they were piloted for in-person delivery prior to the pandemic. But with the onset of COVID, these lessons were transitioned to online learning, in addition to our Cooking Matters at the Store lessons and some of our modules from the Child Care Professional curriculum. It's important to note that these topics that are listed here, we also heard from participants were really relevant during the pandemic time. So they felt like they were on target for lesson delivery and in supportive of participants. With the delivery of these lessons, it was important for us to maintain the fidelity to the lesson goals and objectives, and also to hold true to our best practice of creating a learner-centered environment as best as we could over Zoom. And there was a learning curve associated with that for sure. The lessons were offered in English and Spanish. And as we continued down this path, we learned and we iterated and we kept improving the delivery of online lessons in support of families and also in support of our educators. While these lessons were being delivered online, we also included a carousel of information at the beginning and end of each lesson that was supportive of promoting the pandemic EBT, the Text to Live Healthy program, Double Up Food Bucks, and other food resources in our community, and included the Justice for All poster. I think it's really important to say that our educators were really, really appreciative of being able to support the community in this way and continue to deliver lessons, even though it was virtual, in support of families. If you'll go to the next slide, please. Here is a screenshots of some of our lessons. So as I mentioned, each lesson plan held true to goals and objectives. We developed slides that were used for the lesson delivery and then take home materials. So this is all available in English and Spanish. And the take home materials were always inclusive of one handout that complemented the lesson, but included additional resources as questions and comments came up from participants throughout the lesson delivery. If you'll go to the next slide. As we continued on this path, we listened, we got feedback from our facilitators, we got feedback from our participants, and then we also looked at our data and outputs to ensure that we were on the right path and we were meeting the needs of the community and of our facilitators as well. From our facilitator listening, we really learned that we needed to have 2 coordinators in each lesson in support of monitoring the chat and engaging people through chat as part of the lesson delivery, and then 1 person who was really sharing the content, doing the hands-on cooking demonstrations, and engaging with people verbally. If you'll go to the next slide. The participant listening was a commitment prior to and also continuing on as we're moving down this path. So as I mentioned, the lesson development was informed by participant listening, but then we also took time in June and July of 2020 to go back and listen to participants in both English and Spanish to make sure that the online lesson delivery was meeting their needs, and to make adjustments where we needed to make adjustments as well. And so prioritizing participant listening became an important part and continues to be an important part of what we do. If you'll go to the next slide. We learned a lot along the way. We learned about participant engagement. We learned about survey evaluation. We learned about technology and the need to continue providing training both to our facilitators and our participants around use of technology, and continuing to improve the experience all the way around. If you'll go to the next slide. Data collection is also critical to our work. So this slide is really just a demonstration of offering no online programming and doing no digital reach up until March of last year, and then really quickly making a pivot to provide online education. And you can see represented in the orange graphs, or the orange bars, how the online program delivery has continued to grow as we hone our skills in this way, and as our partners are also working alongside us to promote and recruit participants for online education. If you'll go to the next slide. Here's just an example of some of the data that we've collected around an intention to change survey. So at the end of each online lesson, participants complete an intention to change survey. And I just want to highlight here the bottom section that really shows that participants are engaged in online lessons, they are learning during online lessons, and they're looking for additional resources as well, and to continue on in their learning. If you'll go to the next slide. Here are just a few participant quotes that I wanted to share. So as I've mentioned throughout the presentation, participant listening is really important to the work that we do, and we have a formal process for that. But in addition, we collect participant quotes through the online or through the surveys that we administer at the end of online lessons. And we've just heard time and again from participants that they are learning, that they are engaged and appreciative of the pivots that we've made to offer programming online. And if you'll go to the last slide, please. So our next steps, we know that the pandemic is not over. We're not yet back to offering in-person programming, with the exception of some farmers market tours that we're doing this summer. But we also don't anticipate, as we're going back to online or going back to in-person programming, that our online lessons will go away. They've become a valuable way for us to reach people and to offer programming, and we expect that that will continue as an important way that we reach out in the community. And we'll continue to learn we'll continue to listen to inform the development. One of the things that we know is true, that we have heard and we've experienced, is that building equity into our program is critical. And we know that there are folks who have no or low internet access. So we are exploring opportunities to engage with families in a different way, outside of in-person lessons, outside of online lessons, and how might we build equity for those who don't have the same access to technology. We're doing a recipe review to continue refining our recipes, and also considering child engagement. That was an important part of listening as people were home during the pandemic, trying to find activities to do with their kids, and even throughout the summer and as kids are going back to school, there's a need for child engagement. So we're thinking about how we might build that into our lessons, and have just wrapped up a pilot of some of that engagement, and look forward to exploring those learnings more. So that we can continue to engage families and kids. We'll continue to provide evaluation and look at our impact and how we can continue to improve our programming. Thank you again for this opportunity to present and share a little bit about our work. The last slide here is just a little, some places where you can go to continue engaging with Cooking Matters. And I will pass it to the next speaker.
Hello, everybody. My name's Meredith Scott, and I will be presenting on the ONI Project's Farmers Market Initiative. Next slide, please. I'd like to acknowledge those who have helped with implementing this project or evaluating it. These are the individuals who really helped make this happen, and I am presenting on their behalf. Next slide. I also wanted to give a shout out to the ONI project team. We all work really hard to implement our mission, which is to promote healthy living through innovative and creative strategies for communities, families, and individuals. Next slide. In today's presentation, I'll go over our project objectives, our targeted health behaviors. We are looking at 2 different levels of change, looking at policy, system, and environmental change, as well as population change related to our smart social marketing promotion. We'll dive in deeper to our Harvest Highlight project, which is our featured program that we collaborate with OSU Community Nutrition Education Program, another implementing agency in Oklahoma. We'll end it with a review of our evaluation. Next slide. Here's a list of our objectives. Our first objective is to increase the number of staff accepting farmers and direct farmers markets and direct farmers. We also want to increase the redemption of SNAP at those markets. And then we do want to provide them with the resources needed to implement SNAP in an effective way so that SNAP recipients feel comfortable by using signage, uniform signage. And then lastly, our final objective is an exciting nutritional nudge project where we partnered with OSU on. Next slide. I won't read this in extent, but I wanted you guys to see the theory of change model. I believe you guys will all receive this presentation to read in detail how we apply the theory of change model to our farmers market initiative. And you can see it here as our outputs go in and our long-term outcomes and short-term outcomes related to our indicators for SNAP-Ed. Next slide. We do apply social marketing strategy to our programs. All of these different components to our project help build towards an overall campaign or initiative. And so the green dots here are related to the capacity building of our local agriculture in Oklahoma. And now we'll be going over these a little bit deeper in further slides. And so we have to build the capacity of our farmers markets so they can meet the needs of our SNAP families in Oklahoma. And so the blue dots here are population level strategies where we help introduce and reinforce the positive experiences of shopping at a farmer's market. Next slide. Here's a list of the SNAP accepting farmers markets. Since we designed this presentation, I've actually have 2 more to add, which is exciting. We overlaid this map on this list of markets on a map of our state, showing the concentration of households that are at 185% of the federal poverty line. And we got this data from the census tract. Next slide. So let's talk about how we are building the local food capacity in Oklahoma. Next slide. ONI has been working with Oklahoma farmers markets and producers for well over a decade. And we do this in a lot of different ways. One of our top ways to reach our farmers markets and producers is by co-hosting the Oklahoma Local Ag Summit since 2014. This is in collaboration with the Department of Agriculture, Food and Forestry. And through this, we are able to sign up more farmers markets and producers to accept SNAP. We also use this to help our producers and market managers and whatnot to learn how to build their own capacity through introducing them to ag education and marketing experts in our state. Next slide. We also provide our markets support so that they feel extremely comfortable with accepting SNAP. We guide our SNAP recipient, our farmers markets through the entire FNS process. At the conference, we identify farmers markets and direct farmers that are interested in accepting SNAP, and we help get them directed to what they need to apply for SNAP, an EIN number or tax papers. We then introduce them to FNS and the application itself, answer any questions that we are able to, or provide them with who they need to talk to. Then once they have an FNS number, we help get them established with our state to get a free EBT machine, and then help them as they implement it at their market, making sure that they feel comfortable with any necessary trainings for vendors and volunteers. We provide marketing tools such as roadside banners. We help them with how to word things with social media and emails and whatnot. And we also support them by helping through advertising to our SNAP families that they now accept SNAP. We do provide, this has been extremely helpful during the pandemic. We film short videos that highlight the farmers markets. Each market has its own personality, and this helps make families know what to expect when they go to the farmers market. And so we have several markets that we have highlight videos for. Next slide. So now what do we do to increase new and returning customers? This is the fun part. Let's go to the next slide. We focus all of our efforts on the customer. They are the priority, and we want to make sure we're meeting their needs. So through our research at ONI, we have found that personal autonomy is the top priority. Families want to feel empowered to make choices for their household. And so we really want to promote inclusive environments. We really try to invite families to show that them shopping at the farmers market is their way to support their community and helping them feel empowered through this experience. We also know family is priority. And so showing that farmers markets not only provide the best quality food, but they also allow them to have more opportunities for family time and creating memories. You'll see a lot of our promotions, tomatoes and watermelons. Through our surveys, we have identified that these are prime produce items for our SNAP families. And we want to show them that the markets have lots of these when they're in season, and a great place to pick up great tasting produce. You will taste the difference also in a lot of our work when through some of the focus groups we did with SNAP families. Taste, freshness, and quality were values that they saw as things that would make them want to shop at a farmer's market over shopping at a grocery store. And so these are things that you'll see over and over again in our work. Next slide. Through this initiative, we have lots of different strategies that are always evolving. Like I mentioned, multi-component project. First and foremost, we have to raise awareness. We work with DHS and other organizations to help make sure our SNAP families know which markets accept SNAP and if their community does have a SNAP accepting farmers market. We do provide, such as the video I mentioned earlier, and other support on promotional materials and marketing through social media. One great thing about ONI related to the COVID pandemic response is that we were already set up to do digital outreach prior to the pandemic. Most of our work was through supporting our markets through establishing a social media page and presence to help engage SNAP families. And so through the pandemic, we were able to just reinforce that and build upon what we had already established. We do support the utilization of double up programs, and we work with our markets to help guide this SNAP recipient through the shopping experience and helping them feel comfortable at the market. Next slide. So throughout our promotion, you'll see a lot of all are welcome. Again, we really want to promote that inclusion and diversity, and that all families are welcome to go to the farmers market. We do also say taste the difference a lot. And during non-pandemic times, we would have in-person cooking demos where we give samples out. Through the pandemic, we had to revamp this a little bit and make it more digitally focused, which is what our Harvest Highlight project has done so well. Next slide. So let's go into the featured program, and that is our OSU collaboration. And next slide. So this project has, we had to revamp, but our goal was to highlight seasonal vegetables each month that you can find at farmers markets. ONI worked with OSU Extension Office, the Community Nutrition Education Programs, Nutrition Education Assistants, who are all across the state in many of our counties, to work with their farmers markets and host live market tours from the farmers market Facebook pages and cooking demos. And so ONI helped set this all up by doing trainings, as well as introducing the market, the OSU Nutrition Education Assistants to the market managers, scheduling and managing Facebook posts, advertising, and all the other associated things to help make this program successful. We had 5 markets participate. And here's a picture of one of our example videos where we did it from the Norman Farmers Market page. As you see, we shot the live video from the Facebook page of the market because we want our SNAP families to get connected with their farmers market itself. And this was this really helps enable our families to feel comfortable going to the market, knowing that the Norman Farm Market Facebook page is a resource to know what's in season, and also being introduced to OSU and what new vegetables they might find at the farmers market. Next slide. OSU has made the commitment to host these live market tours, and they have done a wonderful job going to each market, walking around the market, showing what all is available, helping the SNAP families and viewers of our live video to see how you process SNAP at the market, how do you use SNAP. As they shop throughout the market, they visit the different vendors, show the different produce, highlight the vegetable that is being featured, and purchase items to make our featured recipe. And so then a few days later, the nutrition education assistants will take those products and make the recipe live again on the farmers market Facebook page. So really showing how you buy all of the stuff at the farmers market, and then you take it and make the recipe, which is our closest we can do to showing that taste, quality, freshness that you can find at a farmers market virtually. Next slide. And so let's go over our evaluation plan for 2020. Next slide. First, I would like to say thank you to OKDHS for helping us have a SNAP data sharing agreement. And so through this agreement, we receive weekly SNAP sales report by FNS number. Whenever we help enroll our farmers markets with SNAP, we get their FNS number, and then DHS is able to provide us weekly reports on their number of redemptions and the amount of redemptions they've had at each market. We also use this data sharing agreement to help find and contact individuals who live in the zip codes that have farmers markets, so that then we can direct promotion, like email promotions and social media, to those families. We also we use this data to measure our changes in our market sales so that we can identify when are the times that we need to create strategies on improving the SNAP sales. So on the next slide, you'll be able to see that. You can go to the next slide. Sorry. This shows us here how we used our sales data with 5 markets, and we were able to identify that starting in September, we see a drop off in SNAP sales at the market, or SNAP redemptions at the market. So through that, we're able to prioritize promotion and create campaigns that are geared towards that area. So in 2021, hopefully we'll have a positive report showing that we did a campaign to promote SNAP sales in these fall months, because our farmers markets are still prime and have lots of different produce, to help increase the information and education of our SNAP recipients, knowing that they can still continue to shop at the market and the markets are still stocked with wonderful, great produce to purchase. Next slide. So in 2020, we did look at all of our farmers markets that are accepting SNAP, and we had nearly $180,000 redeemed in SNAP. This is a 24% increase compared to 2019. You know, farmers markets are considered an essential place to purchase products. And throughout the pandemic, it's been extremely valuable as grocery stores have fluctuated in their availability. Your local producer has been able to provide consistent vegetables or meat or other food items throughout this pandemic. And with that, we've also seen nearly 8,600 SNAP redemptions at these markets. Next slide. So here's one of my favorite tomato photos prior to the pandemic. We have lots of different photos from our farmers markets that you saw throughout this presentation. Many of them are taken prior to the pandemic, but I do appreciate you guys taking the time to listen to our presentation, and I hope your markets are also doing well. And if you have any questions on what we're doing, please don't hesitate to reach out to me. Thank you. And I'd like to hand it over to Lori Kelly, who is our Southwest Regional Office team leader.
Thank you, Meredith. So good afternoon and good morning to those of you that are in other time zones. My name is Lori Kelly, and I'm a SNAP team lead with the Southwest Regional Office. And I'll be providing a closing summary of our cross-regional outcomes that were highlighted during our presentations today. Next slide, please. So first, we heard about enhanced referral processes. During a time when many people were struggling with job loss and food insecurity, we learned enhanced referral processes are critical to ensuring equitable program access and connecting SNAP participants to SNAP Ed and other nutrition and health related services. Enhanced referral systems allowed SNAP applicants to identify their interest in SNAP Ed classes via the SNAP application processes. And distribution of nutrition education communications via social media, radio messaging, and billboards were also key in promoting other health resources available to the community and reaching a broader audience of SNAP eligible persons. Next, we learned Pandemic EBT, a brand new hunger relief program, was implemented to assist families with the students qualifying for a free or reduced lunch. PEBT provided food benefits to families to cover school meals missed as a result of school closures from the pandemic. SNAP Ed also collaborated with state agencies, community agencies, and departments of education and public health to promote PEBT and link eligible families to the program. Next, we heard about collaborations between programs. During the pandemic, cross-collaboration between programs proved to play a key role in strengthening existing partnerships and utilizing of program resources. SNAP Ed was able to expand services and reach while also meeting the unique nutrition and health needs of community demographics. We saw how coordination efforts were maximized to develop consistent messaging strategies and also support the immediate shifts occurring to ensure program participants were being served. Next, we heard about connecting with local farmers. Connecting with local farmers to increase the number of SNAP accepting farmers markets is a priority for SNAP Ed. Farmers markets are a source of nutrition security and provide an ideal setting for sharing nutrition messages. SNAP Ed has been innovative in creating opportunities to connect farmers directly to their consumers, improving local access, bringing community awareness to the presence of markets, and also supporting economic growth. And finally, we heard a lot today about innovations and adjustments states made in response to the pandemic. States were tasked with making pivots to their pre-pandemic direct education programming to ensure SNAP-Ed delivery continued to meet the community's needs with additional consideration of the health and safety of its program participants. States did a really awesome job implementing various enhancements regarding use of technology to reach a broader audience. They leveraged critical partnerships at the federal, state, and local levels to support SNAP-Ed programming goals, in addition to providing health and nutrition resources to the community, such as food distribution and farmers market connections. We saw how educators became overnight experts in the world of providing virtual education and made quick shifts in redesigning their curriculums to include online classes through Facebook, Zoom, and other virtual platforms. And last but not least, we've seen success demonstrated in multi-tiered social marketing strategies, which work to promote farmers markets, recruit participants for SNAP-Ed classes, and ensure SNAP-Ed messaging continues to reach people where they're at, all while providing valuable tools for adopting healthier habits that we hope will last a lifetime. And this concludes our summary of outcomes. And now I will pass it on to Heidi for our Q&A session.
Thank you very much. Okay, our first question, this one's for Phil and Gregory. What ways have you been using the regional reports? Have you used them with state agencies, implementing agencies, national office, other USDA programs, external stakeholders, state legislators, governor's office, etc.?
Yeah, so this is Philip. I can talk for the Mountain Plains region and then turn it over to Gregory here. So there's a lot packed into that. So let me break it down. So we got to go back to 2017 when we first did the first impact report here in the Mountain Plains region. At that time, DC leadership was looking at cutting out the SNAP-Ed funding from the budget because we didn't have sufficient data to prove that this was actually working, right? That we were making the difference. So looking to cut back on budgets across the government, they were thinking that they could cut this out. So leadership at that time came to Star and I here in Mountain Plains and said, what data do you have in the PAIR system that we were running here in the region at the time? And can you show us or provide us something that shows that what we all knew at the time, the nutrition education does work and that the implementing agencies, state agencies were doing such a fantastic job out here in the street level. So that created the first impact report. And what we wanted to do with that report and then subsequent reports up to this last one here in 2020 was to bring in the human element, right? We didn't want just numbers. We wanted to build that picture of all of the amazing work that we knew our implementing agencies and state agencies were doing out there on the ground, working with eligible participants and making that difference in their lives. And we wanted to paint that picture for our leadership to show, don't cut the funding, increase the funding. This program works. It's needed. Nutrition is our middle name here in the Food Nutrition Service. So we tried to show that. I think we were successful in that. We had several reports here in the region before we partnered with Gregory in the Southwest Regional Office. And of course, we had an in because, you know, Utah was in our state and so supportive of this effort, or in our region, I'm sorry, and supportive of this effort before they went over to the Dallas region. How do we use it internally? So for Mountain Plains, there's so much work that goes into this. There's so much cross communication between implementing agencies, state agencies as they continue to build this and get the data in and all of the different things that you're seeing here, that it builds effective cross-regional communication. So as you saw in this presentation, there's amazing work going on in there, farmers markets, food pantries, things like that. So it really helps one state who sees another state really successful, say in food pantries, that would like to replicate that in their state. So it's continuing to build the best practices, expand across our programs and across this region, and continuing to make SNAP-Ed better in each and every state. So last part of your question, I think you're talking about, do we share with external stakeholders? Yes, we always have. This latest one, 2020, we sent this report to the Office of Secretary, so Secretary Vilsack's office. We shared it with Deputy Undersecretary Dean. We've shared it with the senior leadership in the Food Nutrition Service up in the national office. And we continue to share it with whoever, you know, is interested in seeing it. As you saw on this, when this webinar started, there was over 200 people on the webinar interested in this project. So I think the message is getting out, and now the last 2 years we've been able to include 2 regions to show the great work that's happening across both regions. And we know that the great work is happening across the nation. It's not just in our region. So we would like to eventually in the future continue to add regions until we get a national impact report, because I think it's so important. So I hope that answered the question.
Yes, it did. Thank you. Along those lines as well, so how was this initiated? And I'm thinking Phil and Star, you answer this one too, because you guys have been there from the beginning. How was it initiated, organized? It takes a significant amount of time and a dedicated person to make this happen. And then the next question is about, can other states join in the future, or regions?
So this was not initiated by FNS per se. This was not mandated by the agency. As I said earlier, leadership came to us at that time looking for, better data to support the program. Star and I, of course, has always been supportive of this. We've always pushed to create a document like this, continue to create these documents. But I'll be absolutely honest with you, we don't make this document. We have such amazing people in this region, in our states and the implementing agencies. When we first started this, there was a work group that came together in Kansas. We met for the Mountain Plains Regional Impact Report. They took it. The passion that's in our state and implementing agencies is beyond repair. I mean, they just ran with this and created the documents that you're seeing now. In the first reports, Heidi and her team in Utah stepped up to create the document, or to pull it all together. They didn't create, but pull it all together and print it. Did amazing work. Kaylee in Wyoming and has done that in the last 2 reports that she reported out, and it is a tremendous amount of work. They do obviously a tremendous job on it, but it does create a lot of work. It's a lot of work for the states to pull the data together, get it in the format you see. But again, I can't emphasize how important it is. There are senior leaders looking at these documents. And now with this new administration, with the Biden administration coming in, SNAP-Ed is all over the national priorities. SNAP-Ed is now a major focus for this administration, which is very exciting, because I think we can really take nutrition education across this nation to a whole new level now. And yes, we would love other states and regions to join us.
Awesome. Thank you, Phil. The next one, I think Kaylee might be the best one to answer this, is what challenges in trying to share unique outcomes, PSE efforts, social marketing, community outcomes, etc. do you come across? And then any suggestions on, well, I think you should just explain how you organize it, Kaylee, because I think that's been really significant.
Sure. So the way the report is right now, as Phil indicated, the Mountain Plains region has been doing this for a little longer than the Southwest region. And so we have a data work group in the Mountain Plains region that has been able to aggregate data for direct education impacts for adults, but we haven't aggregated data across states or across regions for PSE, social marketing, or anything in that realm. In terms of presenting the data, what I ask states to do when we're collecting data is to look through all of their data points and pick those data points that best show their effort and their work, their progress, their highlights. And then if I have questions about it, we kind of work back and forth. As Phil said, there's a ton of communication that goes into this. And as the person who was compiling everything and designing it, learning a lot about the way that different programs work and operate, so that I, as I'm creating graphics or putting things together, best understand how to put their best data in the spotlight on their pages. I think there's a lot of potential with this national report that's we've been hearing about, for there to be a lot more aggregation across states and data, states and regions, which is really exciting. But at the moment, we don't have like a summary for both regions really about anything beyond the adult direct education.
Thank you. The next thing someone asked about regional reports, if you can see them, they are on the SNAP-Ed connection. I know because I'm part of Utah. We also have them on our Create Better Health staff page, but they are on the SNAP-Ed connection if you're looking for them. So I think you'd be able to find them, or you can reach out to any of us and we will get those to you. And then we will be sharing the recording slides Q&A out for all those who participated, so you can view it again or share with your colleagues. And we had comments about the cute animated fruit and vegetables, and it looks like someone found them and it's in the chat. So if you want to be able to use those animations, go to the chat and get that from Tanya Wolf. Courtney Slater was able to put that together for us and did an awesome job. And then the last question is opportunities for enhancing SNAP-Ed goals with, but I didn't write down the whole question, with 20% increase in the SNAP benefits starting October 1st. If any of us want to speak to that.
I'm very excited about it. Like I said earlier, FY22 priorities have nutrition education as one of the top priorities for this administration. That in 18 years in the SNAP program is the first time I've seen, the agency take SNAP-Ed as a priority. That's very exciting to me. Throw in, we have the increase in SNAP benefits with the Thrifty Food Plan that just came out. If all of this work that's being done and has been done in nutrition education, the reporting system that has now been adopted by FNS, the impact reports showing the great work that's being done out there, all of that leads to not only continuing the funding of this program, but I hope to increase the funding for this program. And I think we have the administration support behind us to try and leverage that. So yeah, it's a new day dawning, I think, for SNAP-Ed, and I really hope that it continues to expand. We continue to fund this, continue to give the support that's needed out there for our state and implementing agencies.
Thank you, Phil. And then the last thing I wanted to mention is in the chat, there's a lot of great comments. So for the panelists and presenters, please go check those out. If you have additional questions, add them into the chat and we will send those out when we send out the documents. And then if we just go through the next couple slides, there's some resources. So next slide. Here's some resources that you can access. And then the next slide has contact information for the Mountain Plains region. And the next slide has contact information for the Southwest region. I'm trying to go slow, so if you want to find any of these people, you may, or once again, you can ask us in the chat and we'll get those to you. And then the last slide is if you need to contact any of the speakers, then here's a place to get that information as well. Thank you for your time and thank you for being on. We appreciate it and have a great day.